Good morning. You're listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry of Northeast PA. April has this week off, and so I'm Adam Owens filling in for April. Joining me in the studio this morning is Dr. Mike Rogers. Good morning, Doc.
Good morning, Adam.
And we decided for this episode that you would let me do a little freestyle and kind of just ask you some questions that I've always wanted to know about dentistry and what you do for a living. Is that cool?
Cool.
Okay.
Cool.
So I've got
free swim.
I've got a free swim. Exactly. So I've got a handful of questions here. We'll just go through the list and hopefully you can shed some light. And I would expect some folks listening out there might have some of the same questions. So
okay.
Here's the first one. This jumped right to my mind. Look, Doc. Right, be straight with me. Do we really need to floss, or is that just some made-up thing dentists do to torture us?
I believe we really need to floss. All right. What you can reach with your toothbrush is only a small amount of what the tooth is actually there. You can't reach in between your teeth with your toothbrush, no matter how great a toothbrush you have. You got an electric toothbrush, Sonicare, Oral-B, whatever. Yeah. You've got to get in between your teeth. It'd be like, well, I don't want to go there, but it's like going to the bathroom and not.
Yep. Just say no more. I got you. Okay. All right. Okay. Are there any replacements for floss? Like, what about like a water pick or like a Listerine or something?
Once again, it's the mechanical action of getting in. So there's interdental brushes, little brushes that can get in.
Little Christmas tree looking things, right?
I don't usually recommend toothpicks, but there's things called stimudents, and what it is little balsa wood pieces. Because it's such a soft wood, you can go in between your teeth with it. It's not going to harm your teeth. It's not going to harm your gums, and it'll mold to the shapes of in between your teeth. And that's called a stimudent.
I don't want to say that it's like abrasiveness that is the key here, but it is actually like water won't quite do it. You need a physical thing sliding in there and picking up the debris between your teeth.
Well, yeah, mechanical removal is primary. Water picks can flush stuff out, like larger deposits, and it can deliver medications, peroxide, or
whatever you load in there,
antibacterials to kill the bacteria below the gum line. But you still need to get in there and remove the deposits that's stuck to the tooth.
So the phrase you used was mechanical removal.
Correct.
That makes sense. I understand. I notice that when I go in for a cleaning, they tend to go pretty quick around most of my mouth, but then when they get to the inside of my bottom front teeth, like if I just push my tongue directly forward, it's up against the inside of these bottom fronts. That's where an overwhelming amount of the plaque seems to kind of build up. Is there a reason for that?
Well, it's a combination of plaque buildup and which turns hard and is calcified, called calculus or tartar.
Okay.
So it builds up there. It usually you have a preponderance of buildup across the lower front ones, and up on the top right and left molar area is usually more so. Over time, it can build everywhere. But what it is those two spots, we have salivary glands right in those areas that secrete saliva highly mineralized. So there's a lot of minerals in it. So your plaque is a soft deposit. It builds naturally. Within 15, 20 minutes, half hour after a cleaning, your body's depositing plaque. It's going to be there. It's the calculus or tartar buildup that if it's left there for any length of period of time, the minerals in the foods we eat and drink and in our saliva start to calcify it or harden it. And that's what we're scraping off, or those barnacles. I call them barnacles. Barnacles of tartar. And if left go, it'll go below the gum line. It can cause gum infections. It can cause the bacteria associated with that is what we discuss almost every week on how the bacteria in our mouths relate to the overall health and create heart problems, diabetes, things like that. The bacteria associated with that plaque, associated with those barnacles, are the ones that we've got to worry about: gum disease and periodontal disease.
So my own body is actually turning the plaque into the calcified material. It's the presence of my saliva that hardens it.
To a certain extent, wow. It's a double-edged sword. But if you have a lot of saliva or drink a lot of liquids, it should, in theory, flush the bacteria and the plaque away.
Yep.
But depending on the foods you eat and what you eat and the minerals in your saliva, it can also increase the amount of calculus that's formed.
You say calculus, I start thinking about high school
math
class.
Yeah, sorry, tartar.
Never did very good in this. What's a typical interval for a professional cleaning?
Well, it should be not dictated by an insurance company. It should be dictated by your health, your gum health, and your overall health, your systemic health. What's going on in your body? Have you had heart attack, stroke, diabetes? Do you have hip or joint replacements? Because all of these things play a part. Once again, as bacteria in our mouth can leach into our bloodstream very easily, it's only one cell layer away from our bloodstream. So it's very easy for this bacteria to get into our bloodstream. What happens is that every 6 months thing came back was a marketing ploy back in the early 60s. Toothpaste company wanted to sell more toothpaste. So they actually came up with go see your dentist and brush regularly. And so that's where it came. The problem is the dental societies and hygiene societies and everybody else came on board and said, hey, you know what? That's great. Let's make it every 6 months you come in. So that's what insurance companies now say, okay, every 6 months, because that's the norm. That's what it's always been. And so it shouldn't be what the insurance companies say. It should be really what you need.
Case by case.
And what your body needs.
Okay, so some people need to go more often, and it sounds like if your overall health is on the low side, you may need to go a little more frequently.
If your overall health is on the low side, if you've got systemic things or joint replacements, you should come in more frequently. If you have heart problems, have vascular issues, have had strokes, things like that, you should come in more frequently. If you've been tested for oral bacteria and you've got a high preponderance of oral bacteria that can create in the future, yep, and it concerns you that you have these things in a family history of heart attack, Alzheimer's, or strokes, things like that, and you've got the bacteria that correspond to those diseases, it's a good thing to have that discussion and come in more frequently to eliminate it and make sure it's not going to be a problem in your future.
So, I've been around for a minute or two here. I've been alive on this planet for a while. I've seen some documentaries and I've seen some animals and I've been to the zoo, and I noticed the shapes of different animals' teeth. So, for instance, I don't know what, your lion with the big, sharp, pointy canines, clearly put on this planet to eat meat, right?
Correct.
An elephant, the teeth of an elephant. I actually saw an elephant skull at a museum once, and the teeth, they're huge and they're flat. They're like these two fists that just kind of rub against each other, and I expect that's to kind of shred up grass and plant life. Sound about right? So looking at my own teeth in the mirror, it's kind of a combination of both. So like if you were an outer space alien, you came down to Earth to study every living thing, and you looked at their teeth and you looked at a human being's mouth and all their teeth, what would you say we're put here to eat?
We're omnivores.
So everything.
We eat everything.
Okay.
And that's the whole point. Our front teeth are incisors. They're designed just to cut.
Yep.
You put something in, a carrot, chop, there
Snap,
it goes. The middle teeth, the ones in the middle, the bicuspids, they're the ones that are taking a lot of the load, or the preliminary load. They start to break things down, but the real chewing action is done in the back.
Yep.
The problem is people that lose their back teeth a lot of times can still believe they're functioning well with just the front teeth, but the front teeth themselves are designed for cutting. My father was a carpenter. He would always say, you can use a screwdriver as a chisel or a chisel as a screwdriver. And you may use it once or twice as a screwdriver, but after a while, it's not worth good for a screwdriver or a chisel. And that's what happens when you start using front teeth as grinders. And so that's why we start to worry about breakdown of front teeth. So our back teeth are actually protecting our front teeth.
The right tool for the job. All right, we are talking to Dr. Mike Rogers today on Complete Health about just questions that have been kind of burning at the back of my mind for several months. And when we come back, we'll go through some more of them.
Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers of Complete Health Dentistry of Northeastern PA. We believe your mouth is a gateway to overall health. Complete Dental Health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. April has the week off. I'm Adam Owens sitting in for April. And today on the show, I'm just asking Dr. Mike some questions that have been burning at my brain about dentistry. Dr. Mike, thanks for spending some time and being willing to answer my questions.
No problem, Adam. Thanks.
When you fix a cavity or an occlusion, is that the right word?
That's an occlusal is the surface of the tooth that we're working on.
Okay, I'm getting ahead of myself. Sorry.
Yeah.
When you fix a cavity,
Yep.
The idea is you take this drill, right? It is a drill.
Correct.
It's a little smaller, works differently. Air powered generally, or
Air powered or electric. We've even got lasers that can remove decay.
So the idea with this drill is to remove the decayed area and maybe a little bit around it.
Correct.
How big is the hole that you drill? Can you compare it to something?
Well, that's difficult actually because every tooth is different and every cavity is different.
It makes sense.
The thing is, on the surface, it can look like a tiny pinhole.
Yep.
And the outer layer of enamel is hard like the shell of an M&M. But once it gets into the inner tooth structure, which is softer like the chocolate of an M&M, it can spread out.
It can go nuts.
So what happens is you may drill down into that, through that little pinhole and start out as this tiny little spot.
Yep.
But once you get in there and it starts to undermine the enamel, all of that undermined enamel has to be removed. Otherwise, it's just going to crumble.
It's like rust on a car, maybe? Like if you don't get all the decay out and then you pack it and fill it and there's still some decay left under there, can it continue to decay and grow?
It can at some point start over again, yes.
So you want
to remove it. And
all of it.
And try and medicate it in some way, shape, or form in order to prevent it from starting over again. And what I mean by medicated is there's medicines we can put inside teeth that contain calcium and fluoride. There's medicines we can scrub, antibacterial solutions, scrub it on that and let it sit before we put the filling. So now you've got an
extra layer,
a cleaner surface to start with, and that antibacterial kill the decay causing bacteria.
So when you do drill a cavity out, I would guess 10 times out of 10 you numb the area or you numb the tooth, right?
Yeah, I'm a big baby. I get numb if I'm going to have something done. I want to be numb.
So Novocaine is typically what we use for this, right?
Well, that's the generic name because that's what's been around. Usually nobody uses Novocaine per se anymore.
Okay. So you use the store brand or you use the store brand or, well, not the store brand, but so, okay, lidocaine.
Lidocaine, and there's different anesthetics, but we don't truly use Novocaine anymore. But yes, we do use a local anesthetic.
Okay, so how does it work? How does it function?
Well, it interacts with the nerve impulses, the calcium channels within it, or the ion channels in the nerve itself, and that blocks it. And then depending on your metabolism, it can decrease the length of how long that's there or increase the length of how long that's there.
Or your body moves it through, sort of.
Correct. Also, things like caffeine, things like that would speed up your metabolism can also get rid of it a little faster as well, as I find.
So it's almost like the pain signal is still there at your tooth, but the lidocaine or the anesthetic prevents it from reaching your brain, basically, and saying, hey, I'm in pain here. So you don't actually feel the pain once that. And about how long does it take to take effect once you do the little injection?
Once again, there too, everybody is different.
It
depends. And then also, is the area infected, inflamed? Is there things like that going on? Because that's going to play a part. That infection is going to dictate, is it actually going to work properly?
One size does not fit all. This is really case-by-case basis. Okay, so what exactly is a root canal, and why the heck is everybody so afraid of them?
I honestly don't know why everybody's afraid of them. I've got a theory on that. I'll go into it, but I'll start with the what is a root canal. When a cavity or damage to the tooth is such that it goes into the nerve of the tooth.
Yep, and every tooth has at least a nerve. Molars have more than one nerve?
They've got usually more than one root, and each root has a nerve within it, but they all join in the center of the tooth. So it all comes together, and you can't do a root canal on just one nerve of that. You have to do it all. So what happens when there's damage that goes into the nerve of the tooth, your body tries to wall that tooth off, and wall that damage off or the bacteria getting into the nerve off. And the only place to wall it off is at the tip of the root. It's like rush hour at, say, a tunnel going into the city. And so everything starts to back up. That's the infection. Oh. All right. So now you get this traffic jam sticking out the backside of it. That's the infection that builds, and you get pressure underneath it.
Yep.
What happens there is we need to eliminate the cause. So we need to eliminate the bacteria.
Right.
We need to eliminate the dead or dying nerve. And then we need to disinfect it and seal it filled with something that's not going to allow bacteria to get down into your jawbone.
So it basically, root canal, you remove the root and you pack that empty space full of something sterile, and then you seal it back up?
Yes. But it's not so much removing the root, it's removing the nerve. I liken it to,
the nerve.
I liken it to if you have a pen and you remove the ink cartridge from a pen. You've still got the pen, but there's no more ink in it.
Yep.
And the nerve is the ink. So we've removed the nerve. Now what we've got is a hollow pen.
Yep.
We need to pack something in there to seal it. And that's
a really good analogy.
Root canal filling material packs in there, and then we build up around that and then ultimately put a cap on it.
Okay, so after the tooth gets the root canal, is that just the end of the story? Are you good to go for the rest of your life on that tooth, or can something then happen to the tooth after it's had the nerve removed?
Well, once you remove the nerve from a tooth, or once the nerve is dead, the tooth actually becomes more brittle.
Okay.
And so as time marches on from when you had that root canal done, it increases likelihood of the tooth cracking or breaking or fracturing. So if you don't put a cap on it sooner than later, there's no way to know when it's going to break. Now, it's one thing if it chips off and it's a small chip and you can just get in there and fix it with no problem.
Right.
But a lot of times, especially in molars, the crack will go down into the root of the tooth. So now you've gone through the root canal, you've gone through all that work, you've had pain with the tooth, and now you've lost the tooth because the root cracked, or it cracked below the gum line, or cracked in a way that you can't fix it.
Okay, so the solution would be to put a new crown on the tooth, essentially.
To put a cap on it to protect it from fracturing.
Now, let's go into lost and missing teeth, because this can be a problem. There are a number of reasons why somebody may lose a tooth. It could be an accident, but it also could be, a scenario where the tooth was so badly infected, maybe, or cracked that it needed to be pulled out. If a tooth is extracted, is it necessary to replace it?
I believe so, yes.
Okay.
And the reason for that is because what happens is teeth move. If you don't have something in between two teeth, the teeth next to it could collapse into that space.
Oh, into that empty space.
And then it could throw your bite off. The other thing that happens is the tooth above it or below it, if there's nothing for it to bite against, what it'll do is it's called super eruption, meaning it'll keep elevating up out of your jawbone or up till it hits something to stop it, because it's passive. Now, I can't say how fast everybody's teeth move, but they will over time move, and that's what we worry about. Now, if teeth collapse into it, now here's the potential you could lose multiple teeth over time, and that's what we worry about with that, not replacing teeth.
Yeah, so you line them all up. You've got a nice full mouthful of teeth, and you remove one, and all of a sudden they all just kind of want to fill in that empty space.
To a certain extent, yep. And it'd be nice if it was like a little toy boat in a bathtub just kind of bobbing along, and it would just move forward in that respect. But it's more like a tree on a side hill that just wants to kind of fall over.
So it's not a nice straight motion. It's a little angular.
And so the other thing is, the more teeth you start to lose, the more stress on the other teeth now becomes. So now you start to put more stress on teeth that now becomes compromised and could potentially fracture that.
We're talking to Dr. Mike Rogers today on Complete Health. My name is Adam. I'm sitting in for April, and I'm just asking Dr. Rogers some burning questions about dentistry, and we'll be back with more and talking more about replacing missing teeth. Stick around.
Complete Health Dentistry, transforming your health for a lifetime.
Do you have unused dental insurance benefits or flexible spending left for 2018? Did you know that dental insurance benefits and flexible spending have a use it or lose it policy? 2019 is right around the corner. Benefits not used this year do not carry over to next year. Call Dr. Michael Rogers today to schedule your appointment for a wellness visit, treatment, or a new patient experience to take advantage of your unused benefits. Call 570-253-5000. Appointments are limited and filling up quickly. Visit us on the web at Complete Health Dentistry of NEPA.com.
Complete Health Dentistry. Transforming your health for a lifetime.
Good morning. You're listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry of Northeast PA. I'm Adam Owens, filling in for April this morning, and on today's show, we are just asking Dr. Rogers some questions that have been burning at my mind for several years. Dr. Rogers, thanks for being up to this.
Thanks for being up for your part.
This is fun. So we've been talking a little bit about what happens when teeth go missing, whether they're extracted or they get knocked out. And it sounds pretty clear that your opinion is, and I'm inclined to agree, that once a tooth goes missing, you need to put something in its place to keep everything else in alignment.
Correct.
Dental implants are a thing that have been over years more and more accessible. They're not cheap, I don't think. I'm sure insurance probably doesn't cover them, but I think they're becoming more affordable and more people are going with them. To the best of your knowledge, do they have a service life?
Well, they're two. Teeth implants are not teeth, just like teeth are not implants.
Okay.
Teeth have little ligaments that act like shock absorbers.
There's a little flex to them.
It gives them a little bit of flex, a little bit of movement, a little bit of give.
Yep.
So if you bite into something hard, it kind of can tolerate that. Implants are right into the bone.
Quite
there
rigid.
is no more give. There is no more. So one, they have to be set in just right.
Yep.
And balanced just right as well. The other thing is they can last. Teeth are supposed to be lasting a lifetime.
Mm-hmm.
And implants are just a man-made substitute. So we're trying to recreate something that should have lasted and it isn't. And, if we go by, they can last years and years.
Yeah.
I've got patients now with implants well over 20 years, and they're still functioning and doing really well.
Yep.
I've been placing implants for more than 10 years, and they're functioning and working really well. The thing is it all depends on the scenario and why did you lose the tooth to begin with. Was it a car accident, trauma? Was it gum disease and things like that? So once again, we need to address the situation as well.
Makes sense.
And educate on how to maintain these in a way that it is.
What about, now I'm getting a little science fiction here maybe, but maybe not. Can we regrow missing teeth as adults? Is that possible?
Well, right now, literature is saying that we will be in the future.
Cool.
They're talking stem cell replacements, things like that. I don't have the full knowledge on how all of that works. But when we can start replacing teeth with stem cells, and if I'm still practicing at that point, I will be.
A tooth is a tooth. So rather than replacing a tooth with an implant, which is not a tooth, you could replace a tooth with your own tooth. That seems
Correct.
to be the best possible outcome, right?
It would be. It would be, and that would be great. So that.
But also, I'm sure it'd be expensive.
Well, there too, I don't quite have the information on that, so that's why I'm saying. But studies now are showing that it's possible.
Yeah.
So, and once again, there's what was possible used to be is possible now,
Right.
and that's so what's possible now will be in the future.
Very cool. Okay, but I don't know how I'm going to sound when I say this, but I'm just going to go out and say it. Tell me why I shouldn't just have all my teeth pulled out and replaced with a set of dentures or something, so I don't have to deal with any of it anymore.
Well, it sounds simple. It's take them out, be done.
Yeah.
But what happens is there too. It's a plastic replacement for something. They're going to wear down. They're going to break down. The other thing is you've got to keep in mind that you're only going to be able to eat about 10% of what you can eat right now. So if you can bite into a carrot or bite into a sandwich without having a problem. With a denture, when you bite into something, you've got all that pressure just on the front. You're hoping that suction in your mouth is strong enough, is stronger than your bite pressure.
Okay.
And so when you bite on that front edge, the dentures usually want to drop or lift up in the back. And so that's the biggest complaint people have is my dentures move when I bite in the front.
That's the way it goes.
It's the nature of the beast.
Yeah.
The other thing is studies have shown for years that people with teeth, on average, live 10 years longer than people without teeth.
Wow.
And so start taking teeth out now.
Yeah.
Once you remove the teeth hold the bone healthy, keep the bone healthy in that spot as long as you maintain the health of the teeth and the gums. So once you take those teeth out, just like taking trees or shrubs off the side hill, the earth is going to erode. Now, when there's no teeth there stimulating the bone's going to erode. So you're going to start to lose jawbone. You're going to start to lose being able to bite into things, the pressure of the denture themselves. So it sounds like it's a simple fix.
Yeah. But
one, you're decreasing the length of your life. Two, you're going to have problems in the future. And every so many years, you're going to have them redone. Yeah, I understand. There's people out there that says the best thing I ever did. I can eat this, I can eat that. But they're few and far between.
Yeah.
Out of the 30 years I've been doing this, there's far less people saying that than...
Sounds like there's no replacement for the real thing.
Exactly.
So here's hoping for that whole stem cell regrow your teeth thing. I'll cross my fingers and wait a while for that. Okay, so Dr. Rogers, we just have a couple minutes left, but I would love if you would be willing to do this. I came into your office 3 weeks ago. I had chipped a tooth. It was in the back of my mouth. It was actually one of my wisdom teeth, if I'm not mistaken. Can you just kind of talk me through what you did? Because I didn't see any of it. I was laying there in the chair with my mouth open. What happened? What'd you do?
Well, what we did, Adam, is first we determined what tooth it was that was bothering you.
Yep.
Two, then, because I'm a big baby. I want to be numb when I get things done
Same
to
here.
my teeth.
Yeah.
So there are people out there, my wife included, usually don't use anesthetic. They're tough guys. But once again, we determined what it was. In that same tooth, you had an older filling that was starting to leak and break down around it as well. So along with looking where the crack was or the chip was, we went in and we removed the old filling because it was breaking down underneath. Once we removed the filling, we found decay underneath there. We removed the decay. We took care of reshaped the chip, and then disinfected, used an antibacterial solution.
Yep.
We put some calcium-containing medicine down underneath it so that it would help protect the nerve inside the tooth. Your nerve can actually draw this calcium in and help remineralize the tooth structure. And then we built the tooth back up in tooth-colored filling material.
Okay, and so built the tooth back up. What do you just use a little putty and you kind of put it in there and you work it around with your thumb until it looks like the right shape, or what?
Well, not so much with our thumb, but yes, we layer it, or I layer it to the point it's called bonding material or composite. We use an adhesive on the tooth that the bonding material will adhere to the tooth with, and then we just layer the material in almost like to fill the hole back in, and then redesign the tooth to make it look more tooth-like.
So when you finished with all the bonding material, and I closed my mouth, immediately I could feel the bite wasn't right. But what you did was you sort of overshot the mark, and then you used a tool, maybe a drill, I guess, to kind of shape it back down until it was meshing right with the tooth that it bit against.
Correct. Well, what I look at, or what I was looking at, was the shape of the tooth. So I designed the anatomy, or the bitings, the nooks and crannies, where I thought it was. The thing is, you had an old filling in there that was worn down. So you have to kind of take into account that. And then I like to balance the bite in by polishing it into place and making it comfortable in that way.
Well, it feels great, works great. Thanks very much for helping me out, Doc. I really appreciate it. This has been really fun. We're out of time for the day, but I want to thank you again, Dr. Rogers, for being willing to answer some of my questions.
Hey, thanks for doing it. It really is fun.
And if somebody wants to reach out to you, set up an appointment, come into the office, what's the best way to get in touch?
You can reach us by phone, 570-253-5000. Or go reach us online, Complete Health Dentistry of NEPA.com.
Complete Health Dentistry.